Doctor finally said, it's bone on bone, it's time to get it done.
Started with getting some shots. They progressively got shorter term that they were effective. And he and I talked about it and did x-rays, and I had bone on bone, and he said that, you are ready for a transplant whenever you are mentally ready for it. And I said, I'm ready. Let's get this process going.
Before surgery, we have a pre-op class, and they're in pain. They're struggling.
It was very informative, and you got to know some of the people and the doctors and the nurses.
They just laid it out step by step what the process would be.
There was no surprises. Everything was spelled out, what's going to happen right after you get out of surgery, what's going to happen down the road. So that really made it easy and much more comfortable.
The patients are usually very surprised by how quickly the process does move along from the day they have surgery to the next morning.
It used to be years ago that they would stay in bed for a couple weeks, a week or two, and they were developing pneumonia. Things were getting stiff. So nowadays we're getting them up the next day.
I kept saying to the lady, am I going too fast? And she said, no, you're doing fine. And I said, at one point I said, I hope I don't get a speeding ticket, because it seemed like I was really moving.
Patients, when they get up, first time they say, no, I can't do it. And then the third day they're walking out of here like it's a miracle.
And even in 2 days, they're saying, I cannot believe I'm up walking on this joint that was just inserted.
Right away, they get you up next day, you're dressing yourself, walking down the hall already, and going to group therapy, which is fun because it was people that were done at the same time.
There's a lot of laughter, and there's a lot of camaraderie, and the people, they balance each other out. They help each other by saying, oh, come on, you can do a little more. You can do a little more.
They'll kind of see, oh, that guy's kind of getting his knee back a little bit farther. Maybe I can push myself a little bit harder to try to match him.
Probably about 2 to 3 months after they're here, we have them back for a joint reunion lunch, and they just have a ball. We have a real nice lunch for them. They sit there, they visit with people perhaps that they were in the hospital with or have shared the same experience with. And they just talk and joke and laugh and have their lunch, and then they tell us stories of things that they can do now that they couldn't do before.
Nurses, therapists, as they can, will stop down and try to reconnect with the patients just to express our gratitude that we're happy that they chose us, and it's good for the therapist as well to see that everybody's doing well.
It is wonderful to hear how people can start walking again. They can go to the mall, they can go bowling, they can ride their bike, and all sorts of things. Keep up with their grandkids. Before they had to sit and watch their grandchildren, and now they can be up and run with them.
And I think it's all a nice experience.
I had a good experience both times, and I tell everybody, if you're in pain and you need it done, it comes a time when you got to do it. So if you can do it, I recommend you do it, and I recommend here.
I've never seen a more professional group of people, and knowledgeable, and they just do everything, I think, to just set your mind at ease.
The patients often say they feel like they've come to a family when they come to our hospital.
When they go through evangelical joint replacement program, they will get good results and they will be very happy.
Evangelical did a fine job for 2 surgeries. Everything they told me did, and the people couldn't have been better, and a very good experience. And I recommend it to anybody, and I do a lot.